I'm here today to talk about the fact that I've been watching with growing alarm over the last few days. I've been looking at the growing crisis as it relates to healthcare impacting our kids across this province. I've been hearing from parents, listening to frontline healthcare providers who are talking about growing wait times in hospitals all across the province, relating to children who are dealing with a whole range of respiratory illnesses. On top of that, of course, we're dealing with an additional problem that arises from the fact that we have a shortage of children's cold medicine in a number of different places. So this is very, very troubling. And I know how troubling and alarming it can be for parents. Back in the day when one of my kids was 18 months old, she spiked a fever, she had incredible difficulty breathing. I called Alberta Health Services, was told to take her into the ER, and I did. And she quickly got a lot of treatment, x-rays to check on whether she had pneumonia, a whole bunch of other treatments. She was kept in overnight to make sure she was safe. I still recall those moments with great anxiety. And I can't now imagine what it would be like for parents who have the same situation to be told maybe not to go to ER, to just sit and wait, or conversely to go to the ER and be told that they're going to have to wait hours and hours and hours while their child seems to be getting sicker. So in the meantime, what we're noticing is we haven't heard from Danielle Smith on this issue. We haven't heard from the Minister of Health on this issue. And we haven't heard from our Chief Medical Officer of Health on this issue. We have people who are working with kids all across the province who are looking for advice on how best to keep our children safe, and it is time for this government to step up and provide that advice. We know at the very least that we should be getting a plan on how to redeploy staff to ensure that we can provide more emergency services, and we should be getting a plan from AHS around how to use our purchasing power to secure more children's cold medicine and cough medicine and fever medicine from around the world. We have that capacity as a result of AHS, and that is something that the Minister should be directing AHS to do yesterday. So I'm happy to take any questions that folks may have.
Thank you. I'll do a quick check for questions in the room, and we'll go to questions on the phone. Just a reminder to press *9 if you're on the phone. Use the raise hand function if you're joining us via Zoom. If you could say your name and your outlet at the top, we'll go to our first question.
Your advocate. I was hoping to speak to you about, actually it was a situation with a family and their elderly parent that happened recently in Red Deer. They had to wait about 25 minutes for an ambulance after she fell in Red Deer. The ambulance had to come from Sylvan Lake, so there was that delay. And then once they got to the Red Deer Hospital, she was with the EMS staff for 24 hours before she was moved into the care of nursing staff in the ER. She did see a doctor, but during that time, but she had to wait with EMS for quite a lengthy period of time. She's on. She might be getting surgery today for her broken ankle, but there was still extended waits that she had to go through to hopefully get the surgery today. And I'm just wondering if there's anything that could be done for Red Deer Hospital. Some people are concerned that a lot of the resources are going to Edmonton and Calgary, and Red Deer is being ignored, and just wondering how that could be fixed.
So I think, first of all, my heart goes out to that patient, that lady who you described, and also to her family who must have been so anxious through that whole process. You know, obviously what you described there relates to both the crisis that we've been experiencing with our ambulances as well as the ER in Red Deer and the overall resourcing of healthcare in Red Deer. We were promised a much more detailed plan to fix the ambulance crisis some time ago. There are clear recommendations that have been made by folks on the front lines there, which we've not seen this UCP government act on. As well, when it comes to Red Deer, we know that we need to do everything we can to bring in more staff, and also, of course, to move as quickly as we can with respect to the development of a new Red Deer hospital. In the meantime, as we've said a number of times before, our government had introduced a program that hired specifically people to relieve the paramedics of their patients when they came into ER, to watch over those patients when they were in the ER, so that the paramedics could be back on the road. That still doesn't deal with, of course, the delay in the ER. And that's about a lot of things. But what we need is a government that is laser focused on fixing the frontline public health care received by Albertans across this province, not instead dabbling in conspiracy theories and plans to blow up the whole system. That is the opposite of what will bring and keep more frontline healthcare providers in our province able to provide the emergency care that lady in Red Deer so needed.
Any follow-up?
No, thank you.
And we'll go to our next call.
Hi, Megan Cobb, Global News. My question is actually about Calgary City Council and the decision from yesterday to send a Calgary Police Commission report about Ward 4 Councillor Sean Chu's police misconduct investigation to the provincial government. Just wondering how you would handle that situation if you were the Premier of Alberta, and would you look at removing him from his post?
Well, quite honestly, we've always been very frustrated by the resistance of the UCP to take real action against this councillor. He has engaged in behavior that is deeply troubling, including the recently revealed behavior around encouraging harassment of the mayor of Calgary, which I think in and of itself probably deserves even further investigation. There is authority under the Act to commence an investigation by the minister, and ultimately for the minister to do a range of things, including removing that councillor from office. And quite honestly, I don't know why we're still having this debate today. I think it should have already been done.
Can you follow up, Megan?
Yeah, so there is some talk of the limitation of powers for council to sanction one of their own. Just wondering if you've heard those concerns and what your thoughts are on amending the Municipal Government Act.
Well, I think that's a matter that we need to consult with councillors on, and with municipal government leaders on, to find out where they want to go with that particular ability. I think obviously you'd have to be very careful about the parameters you put around it, so that individual councillors don't feel that they risk getting removed just if they happen to disagree with their colleagues. But the standard of behavior, or the absence of a standard of behavior being followed by this particular councillor goes well beyond that. And I think that is something that the provincial government should be working on very studiously with municipal leaders, to give them a solution, because it's not acceptable to folks that we have a councillor in this situation in such a large city in the province of Alberta.
We'll go to our next caller. Go ahead, Dean.
Hi, Rachel. Dean from CP. So I'd like to get your response to Adriana LaGrange today was asked a number of times in Calgary whether school boards have the authority to implement mask mandates if they feel it's necessary. She wouldn't answer. She kept saying it's up to the Chief Medical Officer of Health, and they'll take direction from the CMOH, which is a bit confusing in itself, given that the role of the CMOH went back and forth during COVID. So what do you make of all this?
Well, I mean, what we've got here is nothing but confusion and distraction and an abdication of responsibility by our provincial government. We've got school boards, for instance, here in Edmonton, desperately calling on the provincial government and particularly the Chief Medical Officer of Health to provide more fulsome information about the state of outbreaks across the board, as well as specific recommendations about how best to keep our kids safe, and also about what we can expect going forward. And we're not getting that kind of information. We have a Chief Medical Officer of Health who, although a very credible human being, is not actually even being paid to do the job. And he's still doing his other complete job. So that sounds to me like we've got a government that doesn't really value that role. Moreover, the previous Chief Medical Officer of Health was literally fired because they didn't agree politically with the scientific evidence that she was putting forward or trying to put forward. So what the UCP therefore has created is a mess and a vacuum. And so they're letting down our families, they're letting down our children, and they're letting down folks in our schools, frontline providers, teachers, parents across this province who we have a serious infectious disease outbreak impacting our kids to the point that we have 12-hour lines in front of children's emergency rooms, and we don't seem to have anybody who thinks it's their job to step up and address the matter.
Yeah, to that point, who's in charge, do you think, of public health right now? The Premier has her own group of advisors. The Education Minister points to the CMOH. I'm not clear on who's in charge. Do you know?
Well, I think what's very clear right now is no one is in charge. And as a result, no one is responsible, and no one is providing leadership. No one is protecting the health and safety of our kids across this province. And that is a complete failure of leadership. You know, we can dig deeper into it, Dean, if you like. We've got Danielle Smith seems most interested in talking to conspiracy theorists who believe a vaccine is a bioweapon. As I've said before, we have a shadow group of advisors who she will not disclose the names of to Albertans. And now we just fired our previous Chief Medical Officer of Health because they didn't like her opinions, and now we have a new acting Chief Medical Officer of Health who actually has a gargantuan range of responsibilities in his current job, who has been given no time and no extra money to do this whole other job. So it is in its entirety a ridiculous failure of leadership once again, and this is why Albertans cannot count on the UCP to provide them with health care or to keep them and their families safe.
Do one more pass for questions. *9 if you're on the phone. Raise hand if you're joining us via Zoom. Seeing none, that's all for today. Thank you.
Thank you. Thanks so much for watching, and to learn more, check out albertasfuture.ca.